Cholecystitis is a condition of inflammation of the gallbladder. Usually it's caused by an obstruction of the cystic duct, so that's the duct coming from the gallbladder, and it's usually obstructed with a stone. Stones are formed by usually lecithin or cholesterol, and they precipitate out from the bile, especially in a state where there is a lot of not a lot of movement of the bile. The gallbladder is an organ that helps us to digest our fat. What happens is when we eat fat, a signal goes from the first part of the small bowel to the liver, and it tells the gallbladder to squeeze. If the gallbladder squeezes against a stone, for example, it can cause pain. Or if the gallbladder doesn't have good muscular function, it can cause pain. What happens is in the first part of the small bowel, as soon as the fat hits the first part of the small bowel, a substance called cholecystokinin is released, and that tells the liver to squeeze the gallbladder. In the case of cholecystitis or gallbladder dysfunction, the gallbladder doesn't squeeze properly or squeezes properly against an object like a stone that's causing an obstruction, and that can cause a lot of pain. Symptoms of cholecystitis include severe epigastric or substernal chest pain that can mimic a heart attack, nausea with vomiting, and usually when somebody comes to the ER with the pain, a heart attack is ruled out first. So then we surgeons are called later to manage the problem. Cholecystitis is treated by surgery. There is no such thing as just removing a gallstone. Oftentimes I get asked, well, can't you just remove the stones? And the answer is no. We remove the whole gallbladder. We do that laparoscopically, so we make small holes in the abdominal wall and insufflate the abdomen with carbon dioxide gas. We take it out, and usually the biggest complaint I have from patients afterwards is they get some diarrhea after eating a fatty meal. That's really the main, I guess, morbidity after this operation. Now, there are some serious complications that can happen with the operation, and when you Google the operation, you'll see them. So it's infection and bleeding with any operation, injury to the organs inside the abdomen because we go in with these trocars and these instruments, and then there's a risk of injury to the common bile duct, which is a big problem if it happens. It's really rare. It's less than 1% of the time, but when it does happen, it's serious and usually requires further surgery. It's a pretty big deal. Another problem that happens, and not so common, but does happen a little bit more frequently, is something called a bile leak, where the clips that we put across the duct can just fall off, and then what can happen is a collection of bile can happen in the right upper quadrant where the gallbladder lives, and that usually requires a drain and then an operation, or not really an operation, but a procedure by a gastroenterologist called a stent. A stent is a tube that's placed in the duct that will keep it from leaking out into the abdominal cavity. It's kept for about 6 weeks and then removed.